MS. Cliff, let me follow up a little bit on the congressional fight. So we saw yesterday President-elect Donald Trump, he said yesterday on Twitter. It's time for Republicans and Democrats to get together and come up with a health care plan that really works, which is something I remember you saying similar things in 2009, 2010, when I was covering this debate. Knowing what you know now about partisanship, a president who has tried to do this. Was, like you said, unable to get Republican votes. What 3 pieces of advice? Would you give someone trying to attempt to pass a bipartisan health care law? President Obama, well, look, I think I sort of gave the advice just now, which is, if, in fact, this is not about politics, but this is about providing the best possible health care system for the American people. Then my advice would be to say, what precisely is it about Obamacare? That you think doesn't work? Because you've already said that there are some things you think do work. The Republicans keep on saying, well, we want to keep the things that people like and that are working well. So they think that it's a good idea that Obamacare says your kids can stay. On your health insurance plan until they're 26. They think that's a good idea. They think it's a good idea that if you've got a pre-existing condition you can still get health insurance. I assume they think it's a good idea that seniors have gotten discounts on their prescription drugs. We closed the donut hole during the course of Obamacare. They approve of some of the changes we've made to encourage a healthcare system that rewards quality rather than just the number of procedures involved, and how we pay providers. So we could make a list of all the things that as terrible as Obamacare is, actually they think works, according to them. Alright, well, let's make, then, a list of the things they don't like or the American people are concerned about. Well, what we know is that people would always like lower. Costs on their premiums and their out-of-pocket expenses. And although the Affordable Care Act provides a lot of subsidies to a lot of people so they can afford health insurance, what is absolutely true is we would love to see even higher subsidies to relieve the costs even more. But that costs money. What we also know is that where we've seen problems in the implementation of the Affordable Care Act, it has been in certain areas, particularly more rural areas. Less densely populated areas, where we're not seeing as many insurers so there's not as much competition. Well, one way that we've suggested we could solve that problem is to say that if in fact, there aren't enough insurers to drive competition and reduce costs and give people enough choices. Then we should have a public option that's available. So if you look at the things that people are frustrated about with Obamacare, the Affordable Care Act, the big things are the subsidies aren't as high as they'd like and they don't have as many options as they'd like. And I'm happy to provide both those things. I'd sign on to a Republican plan that said we're going to give more subsidies to people to make it even cheaper. And we're going to have a public option where there isn't an option. Here's the problem. I don't think that's the thing that they want to do. MS. Cliff, I don't think so, no. President Obama, but I guess my point is this, that it is possible for people of goodwill. To try to come up with significant improvements to the law that we already have. But it does require to be specific about what it is that you think needs to be changed. And that, so far, has not happened. And my advice to the president-elect, in fact, we talked about this when I met with him for an hour and a half right after he got elected. I said, make your team and make the Republican members. Of Congress come up with things that they can show will actually make this work better for people. And if they're convincing, I think you would find that there are a lot of Democrats out there, including me, that would be prepared to support it. But so far, at least, that's not what's happened. Mr. Klein, I think Obamacare has exposed an interesting tension between controlling costs in the system and controlling economic pain for individuals. So the law has, until now, come in under budget. But part of the ways it's done that are higher deductibles than people expected, higher copays now in networks. In a couple of years, if it doesn't change, The excise tax on high-value insurance will come into play, the individual mandate. And these things individual people while they keep the usage of healthcare down and they keep the cost of healthcare down. They make healthcare feel more expensive. They make healthcare feel unusable. Do you think the Affordable Care Act got the balance right on controlling? System-wide costs versus insulating individuals from their health expenses? President Obama, well, let me make a couple distinctions. First of all, part of what happened at the beginning of the marketplaces and for those who aren't wonks, I was teasing Ezra and Sarah, I said this is like a wonkapalooza. This is some serious policy detail, here. But so the marketplaces are basically just those places where insurers put up, here's the insurance package we're offering. And you can choose from a variety of different packages, and then once you've chosen you can figure. Out the subsidies that you're qualified for and that will give you a sense of what your out-of-pocket costs are. And what we discovered was that a lot of insurers underpriced early on. Because they had done surveys and look, people who are purchasing health insurance are like people who are purchasing everything else. They like to get the best deal for the lowest price. What makes healthcare tricky is, when you buy a TV you can kind of see what the picture looks like. When you're buying health insurance it's tempting to initially buy the cheapest thing until heaven forbid, you get sick and it turns out, gosh. I can't see the doctor I want or the specialist I want, or this is more inconvenient than I expected. So what ended up happening was people bought, oftentimes, the cheapest insurance that they could. Insurance companies, wanting to get as much market share as possible, ended up creating very low-cost plans, but those are going to have restrictions on them. And that's not just if you're buying health insurance in Obamacare. That's generally how it is even when employers buy health insurance for their employees. Now, I think that what we're seeing is insurers now making adjustments, saying, okay, we need to charge more. And that is something that, the good news is, appears to may have stabilized and might be kind of a one-time thing. And now we're in a position to be able to do an evaluation of have we gotten this balance right, as you say. We can't get health care for free. You're going to have to pay for it one way or another. Either the government is going to pay more so that people don't have as many. Out-of-pocket costs, and that means, in some fashion, higher taxes for somebody or individuals are going to have to pay more out of pocket in one way or another. The same is true for employers. Either employers pay more for a really good health care package, but that takes something out of the employer's bottom line. Or they're putting more costs onto workers in the form of higher deductibles and higher copays. And I think that a lot of the good work that can be done in lowering costs had to do not with cost shifting. But with actually making the system work better. And we've done a lot of work on that. What I referred to earlier, incentivizing a system that instead of ordering 5 tests because Doctors and providers are getting paid for the test. You now have a system where you're going to get reimbursed if the person gets healthy quicker and is not returned to the hospital. Well, it turns out that can, over time, be a real cost reduction. Those are the kinds of things that we're implementing in the system as a consequence of Obamacare. The more we do that kind of stuff, the less we're going to see this cost shifting. But the intention has never been to say let's make it more expensive. For people to get health care, so they're going to access the system more. And I think the proof of that is that even though per person costs have not gone up a lot, the overall spending on healthcare has gone up because more people have come into the system. We want people to use the healthcare system. We just don't want them to use it in the emergency room. We want them to use it to stay healthy and smoking cessation plans, and making sure that they're getting regular checkups and mammograms. Those are the things that are ultimately going to save us as much money as we can. MS. Cliff, I have a wonky follow-up question. President Obama, there you go. MS. Cliff, what about controlling prices? We have some of the highest healthcare prices in the world in the United States. Most other developed countries, they regulate how much you can charge for an MRI. For an emergency room visit, for an appendectomy. That seems like it's really at the core of this tension, the fact that we have these very high prices. Americans don't go to the doctor more, we just pay a lot more when we go to the doctor. That is something the healthcare law did not tackle. And I'm curious to hear you reflect on that and what you would. Think about the role of price controls in American medicine.